Good morning, dear friends and colleagues. I'm Dr. Mandy from the Hong Kong Society of Children's Palliative Care, and we are very honored and privileged to have Dr. Stefan with us this few days for an EPAC course in Hong Kong. And it is very kind for Dr. Stefan in between this section to have this online lecture on about something to prevent pain to share with all of us around the Asia. So let's give the time to Dr. Stefan.
Thank you so much, Mandy, for this introduction, and welcome everyone. Greetings from Hong Kong. So I'm actually originally from Oakland and San Francisco in the beautiful Bay Area. So hopefully things do calm down and you're welcome to visit us there. Those of you who came on time, you already see in the chat.
This meeting is being recorded.
That this is actually my handout. So you're very welcome to see this and additional articles and material in there. And Mandy, maybe you can, for those who have come later, sort of just copy and paste my message for those. So let's talk about data of procedures which cause the most untreated pain and anxiety among children. Explore how untreated procedural pain in children results in high morbidity and mortality. And then we're going to discuss evidence-based modalities to prevent or ease procedural pain and anxiety, which should be offered to every child, every time, everywhere. We are going to be having so much fun. All right. So I'm in Hong Kong at the moment. I was in Singapore last week. If I go to any hospital right now, to any doctor's office, and I ask every single child, what are you most afraid of seeing a doctor? What is every single child going to answer? Of course, it is the needle pokes, the needle procedures. Because when children come to us, healthy children may get 16 to 20 vaccination the first 2 years of life. Once children get ill, they get blood draws or intramuscular injections or lumbar punctures or intravenous cannulations, something which is particularly anxiety-provoking and very, very painful. So I'd like you to watch this short video. It's about 1 minute. So this is made in Denmark, but of course this can happen all over the world. And even if you do not understand Danish, I want you to look at this 5-year-old boy who fell off his bicycle, who's coming into the emergency room, and everything is going really nice. He's very cooperative. He is collaborative. He is getting stickers. And then something is going wrong. And so I'd like you to sort of have a look at this and tell me afterwards what's going wrong here.
Du slår din finger, sæt du ham op her. Han har fået revet det yderste stykke af fingeren af, og det hænger meget løst. Hvad var der sket? Lidt. Nu pakker jeg den op forsigtigt her. Og så kommer Mikkel. Er du kommet til skade med fingeren? Jeg pakker fingeren ud af forbindingen. Kan jeg se, at det er... Det vi gør, når vi skal bedøve fingeren, sådan så at det ikke kommer til at gøre ondt, når vi skal rense og sy. Og berolige drengen hele vejen. Så vi holder hånden der. Sådan en 5-årig dreng kan godt være rigtig stærk, så vi er nødt til at hente noget forstærkning, som simpelthen kan holde ham fast. Både at bedøve fingeren, og vi ikke nogle flere kollegaer, og så er vi 5 voksne mennesker, der er nødt til at holde hans lille arm, for at vi kan få...
Should we quickly have a look how many adults are holding down this 5-year-old boy for an elective procedure? We're not saving lives here. This is unethical. This is bad medicine. This is terrible, yet it may happen in most children's hospitals all over the world, in high-income countries, in medium-income countries, in low-income countries. So, and I often give those presentations and people just say, Dr. Friedrichsdorf, we just do not have enough staff for pediatric pain control. Well, it's amazing that we always have enough staff to hold down children. So what if getting shots wouldn't hurt? Let's talk about the why. Why do we need to do this? Let's talk about the what. What are we going to do? And let's talk about the how. How are we going to do this? Estimates show that as many as 2 in 3 children and 1 out of 4 adults have a strong fear of needles. And this negative experience, of course, results in needle fears, and that means that children, teenagers, and adults will be anxious about seeking out healthcare. They may not be getting vaccinated. So all those strong men during COVID who basically said, oh, I did my own research, you just have to stay healthy, you don't need a vaccination, they're afraid of needles. And these are the people who then get measles and who then infect children with cancer or with immunocompromised children who are treated for cancer or babies. And then those babies get measles and may die. So we need to do better. Managing injection pain improves vaccination compliance and, of course, makes life much, much better for everyone who's working with children in a hospital. We often find, babies don't remember, just hold them down. Well, they do remember. We know from boys who have been circumcised without any pain control, compared to boys who have been circumcised with pain control, meaning Emla cream and a penile block, that those boys who have been circumcised without pain control actually scream much longer and much harder at their 4 to 6 month routine vaccination. And this is just one painful procedures. Many of our babies on the intensive care units in the hospitals get dozens or hundreds, up to 480 painful procedures before they go home. And those painful procedures on the neonatal intensive care units, of course, increases morbidity. Children are crying. They are having increased pressure inside the brain, so they have a higher risk of developing intraventricular hemorrhage. And actually severe pain has a higher risk of death, mortality. So we want to do better. And how they remember is going to influence the experience during subsequent procedures. So when Marius comes back 1 week from now or 1 year from now, he will remember being held down. He will have a lot of anxiety. He will need lots, and he will be afraid hours before and hours after. So he will need more analgesia and more anesthesia. And in fact, even if you do the right thing the second or third time. So we need to be really good the very first time a child comes into our healthcare system, because poorly treated pain is preventable harm. So I just told you, research has shown that the #1 priority of children is preventing pain and anxiety caused by needles. The #2 priority of parents is pain control. #1 is find the underlying disease and treat it. So what percentage of your institution's budget, or what percentage of your institution's clinical staff is allocated toward the #1 concern of your children, of your pediatric patients, and the #2 concern of parents? Or is this rather everyone's problem and nobody's responsibility? All right, we talked about the why. Why do we have to make sure that children do not feel any pain with needle procedures, or at least have much better pain control? So let's come to the what. What do we have to do? How do we eliminate in 80% of the children, or at least reduce in the other 20% of children, pain and anxiety caused by needles? I asked one of the most famous American philosophers, Joey Tribbiani, and he said it's not rocket surgery. So much of the data, the evidence I'm showing you, has been around for a very long time. And it's not that this is sort of brand new information.
Hello, lovely people, and welcome to UCSF Benioff Children's Hospitals in Oakland and San Francisco. My name is Dr. Stefan Friedrichsdorf. I'm the proud director of the START Center for Pediatric Pain, Palliative Care, and Integrative Medicine. Here at UCSF, we are committed to making every child's experience as comfortable as possible, especially during needle procedures. We actually use simple, effective techniques to reduce or even eliminate pain and anxiety. But don't just take it from me. Let's hear directly from our patients who know all about the Comfort Promise.
Hey everyone, welcome to UCSF Benioff Children's Hospital. I'm Ashwarya.
And I'm Claire.
We're here to tell you about something that makes hospital visits way better. It's called the Comfort Promise.
The Comfort Promise is all about making sure kids like us don't go through unnecessary pain or stress during needle procedures.
Things like getting a blood draw, a vaccine, or an IV. They've made it so much easier.
And the best part? This isn't just for some kids. It's for every child, every time.
The Comfort Promise has 5 key strategies to help kids feel more comfortable during procedures.
First is numbing cream. It goes on before the procedure so you don't feel much, just a little push or pressure.
Then comes comfort positioning. That means you can sit in a way that feels safe, usually with a or caregiver.
And don't forget distraction. I love watching videos or playing games on my phone while it's happening.
Like picking which arm to look at first or when to start. I like giving a thumbs up when I'm ready.
For babies under 12 months, they use things like sugar water or breastfeeding during the procedure. It really helps.
And for older kids like us, they make sure to debrief afterward and help us remember the good parts of the experience. It's pretty cool how they've thought of everything to make our hospital or clinic visits better.
So remember, if you are coming to UCSF Benioff Children's Hospital, you can count on the Comfort Promise to help you feel better.
Thanks for joining us.
At the UCSF Benioff Children's Hospitals, we promise to do everything possible to prevent and treat needle pain for every child, every time, everywhere.